Symptoms of pregnancy. In this video today we are going to talk about the symptoms of pregnancy, the early pregnancy symptoms. What are the symptoms of early pregnancy? We are talking about the symptoms of pregnancy. Gerald Massa, the Health Educator, is the name of the channel. I welcome you, my friend. On this channel, we talk about the ovulation calendar. We talk about the ovulation calculator. We do also give pregnancy tips. We do give pregnancy advice. I welcome you, and remember to hit the subscribe button so that you do not miss any videos we put out every day. Without further ado, we are going to talk about the symptoms of pregnancy after this short message. Please keep watching. Don't leave. After this message, I'm coming back. Thank you, my friend, for staying around. We are talking about the symptoms of pregnancy, and the first symptom of pregnancy is there's going to be a missed period. The first symptom of pregnancy, the first symptom of early pregnancy is missed periods. When we talk about missed periods, specifically, we are talking about you not seeing your periods. You were supposed to see your periods maybe this month, but you missed your periods. This could be a sign of early pregnancy. It could be a sign that you are pregnant. When you see that you have missed your periods, the next thing you need to do is you need to go to your doctor. You need to go to the drugstore, go to the pharmacy, and then get the pregnancy testing strip. Do the pregnancy test at home. I have a video about how to do the pregnancy test. You can watch that video after this video so that you can know how to do the pregnancy test. So what you need to do is, if you have missed your periods, make sure that you do the pregnancy test. It could be the first sign that you are pregnant. Next pregnancy symptom is fatigue. When you feel fatigued, when you feel tired all the time, this is one of the first signs to confirm that you are pregnant. The fatigue and the tiredness is due to your body using lots of energy for the development of the placenta, the baby's placenta. Remember, the baby's placenta is that part the baby is going to use for feeding, for respiration, that is for breathing, and then also for excretion. So it also helps in supply of hormones to the baby. So the growth of the placenta normally needs, or it takes, lots of energy. So the second pregnancy symptom is what we call fatigue. When you feel fatigued, when you feel like you are tired all the time, remember, this could be pregnancy. But still, if you do the pregnancy test and the results come out that they are negative, still wait for 2 weeks and then repeat. But if the fatigue is really a lot, if it is so much, then you need to consult your doctor, who will also request, or who will also do some other investigations to make sure that you are not having maybe malaria, or you are not having a bacterial infection causing the fatigue. So the second pregnancy symptom we've talked about is fatigue. Next pregnancy symptom is smell sensitivity. You will have an increased sensitivity to smells. When you are a woman and all of a sudden you have an increased smell sensitivity, remember, this could be a pregnancy symptom. It is due to the hormones circulating in your body. The hormones we are talking about here include progesterone, estrogen, and then of course the luteinizing hormone. So what happens, most specifically, it is progesterone and estrogen. When these hormones are circulating in your body due to the pregnancy, which is in the early stages, you are going to have an increased smell sensitivity. Next pregnancy symptom is morning sickness. When you get morning sickness, this could be a confirmation that you are pregnant. By morning sickness, we are talking about that feeling you get early in the morning. You feel like you are very sick. This is an indication that you could be pregnant, all you need to do is you need to have a pregnancy test done. You can do this at home, or you can actually go to hospital where your doctor will do the test for you. If it is negative, if the urine pregnancy test is negative, then your doctor will do the blood pregnancy test, also known as the serological HCG test. Still, if it is not so clear, your doctor will go ahead and then do the pelvic or the pelvic ultrasound scan, which will show that your endometrium, that is the inner lining of your womb, it will be increased, or it will show signs of increased thickness. This is among the first signs of pregnancy. So we have talked about morning sickness, and we have said that it is among the first signs of pregnancy. Next pregnancy symptom is food aversions. By food aversions, I'm talking about when that feeling you get when you have been eating some particular types of foods. You have been eating almost all the foods that are really interesting to you, but all of a sudden you no longer have interest for those foods. You used to love chicken, but you no longer love chicken. You used to love eating rice, but you no longer love eating rice, or just that smell, or just even a thought of that particular food, you just feel like throwing up. So when you get that kind of feeling, it is what we call food aversions. And the next thing you need to do is head right away to the pharmacy, buy the pregnancy testing kit, and then do the pregnancy test at home. You can also do it at your nearby hospital or healthcare. Remember to subscribe for new videos like this. We put out every day at exactly 17 hours East African time. We release new videos. Come every day at exactly 17 hours. I release new videos about women's health, about the ovulation calendar, about how you can get pregnant faster naturally. Gerald Massa, the health educator, is the name of the channel, and we are talking about the symptoms of pregnancy. The symptoms of pregnancy. Next pregnancy symptom is what we call mood swings. When you have been a very happy person, a jolly person, and then all of a sudden your mood changes and you begin getting depressed, you begin getting those mood swings. Today you are low, tomorrow you are happy, you are high. So by talking about high, I'm not talking about the high brought about or induced by drugs. Just naturally, someone like just gets so happy, and then all of a sudden that person gets so annoyed. That person has not been quarrelsome, and then all of a sudden they begin getting quarrelsome, and then something small they get irritated and they talk lots of words. This could be a sign of early pregnancy. All you need to do is don't sit back. You need to do the pregnancy test. But still, we can rule out other conditions like anxiety, but still we should just focus on pregnancy. If you are a woman and you have missed your periods, you are fatigued, you have smell sensitivity, you have morning sickness, you have food aversions, and all of a sudden you are getting mood swings, then you need to talk to your doctor, who will evaluate you for pregnancy. Thank you, my friend. We are proceeding with the symptoms of pregnancy. I'm really so happy that you have stayed with me all this while. Do not leave. We are pushing on up to the last pregnancy symptom, so that by the end of this video, you will know that when you get any of these symptoms, you are most likely pregnant. Confirmation has to be done by doing the urine pregnancy test or by doing the pelvic ultrasound scan. Next pregnancy symptom is breast changes. When you are a woman and your breasts have been normal, you are actually having maybe mid-sized breasts, they have been having that particular size, and then all of a sudden your breasts begin to become engorged, they begin growing, they begin swelling in size, and then also your areola, that dark part around your nipples, begins to increase in diameter, it begins to increase in size, and then still you begin seeing some goose bumps, some small swellings around the areola. These small swellings are called Montgomerys tuberculosis. Montgomerys tubercles. Yes, these small swellings around your areola, they are called Montgomerys tuberculosis. These small swellings or Montgomerys tuberculosis are very important because they are responsible for producing the oil which will be needed later on when you give birth and then you begin nursing or you begin breastfeeding. They provide the oil for lubrication, for keeping your breast actually oily so that it does not dry up. When these Montgomerys tuberculosis are not produced, then it means you can easily have a dry, your breast skin can dry up, and then you can end up getting small ruptures or small breakups on your skin, which can actually act as a site of infections like mastitis. Mastitis is a it's a breast infection which can actually lead to serious conditions. So Montgomerys tuberculosis or those small goosebumps begin growing around your breast in preparation for the nursing, the breastfeeding that is going to take place. So if you are that lady, you have not been having the breast swelling, you've not been having these small goosebumps around your breast, also known as Montgomerys tuberculosis, you have been having a normal areola, and the areola is that dark part around your breast, then you need to make sure that you do the pregnancy test. These changes in your breasts could be, or they could indicate that you could be pregnant. Gerald Massa, the health educator, is the name of the channel, and we are talking about the symptoms of pregnancy. The symptoms of pregnancy. Next pregnancy symptom is there's going to be frequent urination. Every time you are going to be feeling like you want to urinate. When you are a lady who you have not been urinating a lot, and then all of a sudden you feel like you want to urinate every time you are going to urinate, and the urine you are releasing is a lot, and it's actually even having that smell which is not so good, then you should make sure, just a correction, urine has that pungent smell, but in this particular case, the urine has that very deep smell, which actually may be really a lot. So when you have frequent urination starting, you urinate a lot, and even the amount of urine has increased, it is basically a sign, it could be an indication that you are pregnant. The cause of the frequent urination is due to your kidneys being pumped with lots of blood, and your kidneys being supplied with lots of blood due to the baby's placenta that is growing. So when the placenta is also being supplied with lots of blood, it's also going to release lots of blood, which will go back to the kidneys, and the kidneys in turn will pump out lots of urine. The other thing is that as the baby is growing in your womb, or as the baby is growing in your uterus, the increasing size of the uterus will also act on the bladder. It will also tend to push your urinary bladder, and in such a way you realize that the urinary bladder will be holding urine but for a little while, just because of the increasing size of your uterus. Thanks a lot, and we are proceeding to the next pregnancy symptom, and this is known as bloating. When you are a woman and you have been having a normal size of your stomach, but all of a sudden you feel your stomach has increased in size, it is bulky, every time you feel like you are satisfied, you are very satisfied, do not worry, this could be a sign of pregnancy. This could be that it could be the first indication that you are pregnant. When you get bloating or you get a full stomach, then you need to check yourself for pregnancy, because bloating is due to the hormone progesterone. What happens is that this hormone known as progesterone, it slows down digestion. When it slows down your digestion, thank you my friend for staying around. We are still proceeding with the pregnancy signs and symptoms, the symptoms of pregnancy, and we have said that the next pregnancy symptom is bloating. When we talk about bloating, we are talking about your stomach feeling full every time you feel like you are so satisfied. This is due to the hormone called progesterone. What happens is that this hormone slows down your digestion, and when your digestion has been slowed down, this is a normal thing. You should not worry about your digestion being slowed down by the hormone progesterone. When digestion has slowed down, this gives time for the nutrients in your food to enter into the bloodstream. When the nutrients have entered into the bloodstream, these nutrients will be transported through the umbilical arteries and the umbilical veins. These nutrients will be transported to your baby so that the baby gets also these nutrients. So the slowing down of the digestion is due to the hormone called progesterone, and it's a normal occurrence whereby these nutrients have to be given time to enter into the bloodstream so that they are supplied to the baby. So one thing you have to know is that when digestion has been slowed down, the end result is going to be there's going to be bloating or accumulation of gas. And even if you go to hospital and you do an obstetric ultrasound scan, your doctor or your sonographer, the doctor doing the scan, will tell you that your abdomen is full of gas. Next pregnancy symptom is raised body temperature. Raised body temperature is one of the signs and symptoms of early pregnancy. This happens simply because when pregnancy or when implantation has taken place, your body is going to be working a lot. Remember, there are lots of hormones circulating in your body, in your system. So when your body temperature rises, this is a sign that you could be pregnant. All you need to do is you should go talk to your doctor, who will do some tests on you, who will request some tests to be done on you. For example, the urine pregnancy test, the blood HCG test, and then also the pelvic ultrasound scan to get clear results. Next, but before we go to the next point, I wanted to point out something very important, that if you get your body temperature rising and you are a woman, much as we may talk of, or much as we may think of pregnancy, you should have yourself checked at your doctor's office. You should go and see your doctor, simply because the rise in temperature could also indicate, or it could mean something else. It could mean that maybe you could be having an infection which is actually spreading into your bloodstream, also known as septicemia. So when you get your body temperature rising, do not sit at home. Have yourself evaluated at hospital. Next pregnancy symptom is implantation bleeding. Implantation bleeding is one of the key symptoms of pregnancy. It is a confirmation that implantation or attachment of the fertilized embryo has taken place on the womb. What happens is that when the fertilized egg comes in, it grows into an embryo. It begins by dividing. First of all, when an egg has been fertilized, it begins by dividing itself into two, and then it goes on undergoing cell division by a process known as mitosis. It undergoes cell division, but in a shell which is known as the morula. When this morula or the combination of the dividing cells, which are actually dividing rapidly, so when this thick shell known as the morula moves down or slides through your fallopian tubes, assuming that your fallopian tubes are not blocked. So when they are blocked, the fertilized egg grows into the fallopian tubes, and this is what we call an ectopic pregnancy. I have videos on this channel. After this video, you can go and watch ectopic pregnancy videos. So when this egg has been fertilized and it is moving, remember, it begins by dividing into two cells, and then it goes on undergoing rapid cell division, but still under a thick shell known as the morula. This morula slides down through the length of your fallopian tubes, and then it goes up to your uterine womb, where it attaches or it implants. So after it has attached itself onto your uterine wall, there's going to be blood vessels on your uterine wall or your endometrium. Attachment of a fertilized egg or attachment of this fertilized egg onto your uterine wall is going to lead to rupture of blood vessels. Rupture of these blood vessels, also known as lacuna, brings about bleeding, it brings about blood to actually be flowing, but this blood is also known as spotting. Is not a lot. It's a normal thing. When you see spotting or when you see little blood on your knicker in the morning, you should not worry. It is what we call implantation bleeding. It could be a sign of confirmation that you are now pregnant. In this video, we have been talking about the symptoms of pregnancy, and in summary, we are going to repeat all the symptoms from the first symptom. We said that the symptoms of pregnancy include missed periods, fatigue, smell sensitivity, morning sickness, food aversions, mood swings, breast changes, frequent urination, bloating, raised body temperature, and implantation bleeding. I thank you, my friend. I hope by this time, if you have watched this video for this while up to this point we've reached, then you are well aware of all the pregnancy symptoms. So there could be others we've not talked about here, but these are the key pregnancy symptoms. These are the key early pregnancy symptoms. I have a book out, Ovulation Calendar, Get Pregnant Faster. It is available. It is a very fantastic book. It is an ebook. You can read my ebook in the it has lots of information about how you can get pregnant faster. I wrote this book. The link is in the description. The first link, you can go to the description right now. You click on it so that you can go and read your fantastic ebook. It is about how you can get pregnant faster. It talks about lots of things, including the ovulation calculator, the drugs you need to use the drugs that you will be given by your doctors to get pregnant faster. It is a book meant for health education, so you have to make sure that whatever you read in there, you should just work hand in hand. Remember, the journey to getting pregnancy, it involves a couple working together with their fertility expert, and then all together putting in prayers, and things can work out. I welcome you, my friend, and remember to come back tomorrow for new videos I release every day. In this video, we talked about the symptoms of pregnancy, and we have talked about all of them. Have yourself a fantastic day and keep watching. I have some important messages for you coming up next. Thank you. Thank you, my friend, for attending today's lesson. I hope you have learned something, and please, if you have any questions in regards to what we've just discussed, leave your questions in the comments. Ask me your questions. I will answer all your questions. On this channel, Gerald Massa, the health educator, I talk about women's health. Have yourself a fantastic and healthy day, and may God bless us all. Bye-bye.